All right. 2 minutes, 2 minutes, 2 minutes.
Doria's in the holding room.
Is she? Okay. I'm learning this, so I will, I'm going there now. There we go. All right. Middle. There we go. Everyone's in. We have 1 minute and a half, 30 seconds. So I like to be very precise with time. And um, hey, Miss Doria.
Hello.
Hello there. Just so you all know, if there's any questions that come up on the live stream, if we have time towards the end of the hour, I'll fill them to you.
Are we going to go like an hour? Is that your thought?
Yeah, hour or less. Yeah, I don't want to
kind of play it by ear.
Yeah, I know it's been a long day for a lot of us, so I don't want to keep anybody away from home. That
That's Doria's life.
Yeah, right. That's the hardest working person in the city. No slighting to anyone else, but she's always.
She is.
We got. Thank you. We got a lot of good ones, though. We got a lot of good people here. I'm blessed to work with a lot of great people and great community.
Yeah, we love our city. All right.
I don't know why I stick my pinky out when I drink.
Hey, that's it.
I don't know if you guys just caught that, but I saw myself and I was like, that is not a good look.
I guess that's when you know it's good.
Very true.
All right, it's 6 o'clock. Yeah, so good evening, everyone. To those that are here on Zoom and others that are on the live stream, thank you for tuning in. This is just a community forum. We're done virtually to discuss COVID in our community. We have with us our mayor, Scott Midas, and we were just joking. We were saying the hardest working person in the city of Desert Hot Springs, our assistant city manager, Doria Wilms. This came about because I think a week and a half ago, I reached out to our city manager and asked him if we could make this happen. I know that Mayor Modis and Ms. Wilms do an amazing job on the City of Desert Hot Springs page, informing us and letting us know what's going on. However, it appears that certain parts of our community don't even go to that site at all, that page at all. So it was saying, how can we use our platform to bring attention to what's happening with this virus in our city? So coincidentally, yesterday, our governor did what many of us thought that he would do, put us on a timeout. We don't know how long. We don't know how long this timeout's going to be, but I'll tell you guys this much: I just pulled up to a gym in Palm Desert, and they said we got to close right now, and that was it was heartbreaking. We found another gym in Palm Springs, but we were able to go work out and realize that may be the last workout for the next 2 to 3 months. So things like that. I just wanted to kind of get out there as to why these things are happening and what can we do to help kind of stop this spread. All right, so I did send, did you all get the questions that I sent over?
Yes.
Everybody?
Yes.
You got it? Okay. All right, so we're going to, well, let's do this. For those that may not know you, Doria, would you introduce yourself? I know everyone knows the mayor. They know who he is. They pick on him all the time, but Doria, they may not know who you are. Would you please introduce yourself?
Sure. So as you mentioned, I am Doria Wilms. I'm the Assistant City Manager and also Public Information Officer for the city. I am born and raised here in Desert Hot Springs, raising my family here. I was in the private sector for my entire career up until 2016 when a position opened up here at the city. I jumped at that opportunity and I have been here since, and I have loved every single minute of serving the community, like I said, that I was born and raised in, that I'm raising my kids in, and it's an honor to be doing this.
Thank you. Thank you. Mr. Midas, Mr. Mayor, just in case people don't know who you are, sir.
Well, I first of all want to thank Word of Life and Bishop Shepherd for allowing us to to reach out even further. As you mentioned at the beginning of this, it's tough. We try to get out of many social platforms as we can, but it just, especially with COVID, how do you get out and get the message out? So this was awesome. I jumped at it when he asked me to help be part of this. So thank you for that. I've been born and raised resident of Desert Hot Springs, elected to the city council in 2007, and elected mayor in 2015. My whole mantra has been information's power. I can't control everything. I'm one vote on the city council, but the more information that I can get out there, I think you as residents can make better decisions. And I hope that you see that from my perspective on the city council and our staff's perspective.
Thank you. We see a couple other members of our city staff on, so thank you guys for joining us as well. So I'm going to get right into it so I can get everyone home for dinner at a decent hour. Obviously, the governor's orders kind of took some by surprise, but it came yesterday. And so that kind of changed the trajectory of what we were doing here in the city. How long do you guys think this will last? And how do you respond to the people that say Desert Hot Springs is a small city? How come it has 400 cases already?
I'll start. I'm good at talking about issues from a 30,000-foot view. It's kind of what I feel my position is as the mayor, is to kind of set policy and give that overview. Doria is really good at the details, so she'll probably get into a little of that. But first of all, to answer the question on our city's population is 28,000. If you look at as of today at 3 o'clock, we have 458 cases and 5 deaths. Not to downplay anything, that's not what this information is for. Again, this is information's power. That's a little over 1.5% of our population has coronavirus or has had coronavirus. And so I feel we're doing good. If you actually go to the interactive map on RivCo PH, which is Riverside County Public Health, rivcoph.org, and hit the coronavirus tab, you can actually see an interactive map of cities in Riverside County. They update them between 2 and 3 o'clock every day. You can see how many cases, how they're projected, even the ethnicity of what groups have higher rates of coronavirus, the age groups. Really a lot of great information on that. I have 2 pages of information here that I wrote down today just to make sure I had the proper numbers. But that's kind of where we're at when it comes to that. Looking at the question, I think I veered off a little bit on that. But the governor's orders came out the other day, and I'll say this, it's a roller coaster. From the council's perspective, we have put onto our agendas for each council meeting in closed session a discussion from the council level on what we need to do to prepare, what we need to do to enforce, what orders can we strengthen. When the governor comes out with an order, it's the law. When the county comes out with an order from the public health, it's a law. We can't overrule those, even though people think we can, because we would be defiant. And there's a lot of funding that comes from the state and federal government that we could lose because of that. And that's been threatened by the governor. So we do comply. And then we can strengthen those. We can go up and beyond. We just can't go below. I'll let Doria kind of chime in on some of the things that we've done.
So actually, just prior to the town hall tonight, I made sure that I reached out to my contact at the county who works with Supervisor Perez's office, just to make sure that I had the latest and greatest information. And one of the questions that I specifically asked him was, how long do we anticipate the most recent orders to be in place? And there's a lot of information that's out there. Certain counties are saying 3 days. Some counties are saying 3 weeks. For us, for Riverside County, and for all of the counties that were not on the watch, were on the watch list for longer than a 3-day period. So the Riverside County's been on the watch list now for a couple of weeks. Any county that's been on the watch list longer than 3 days, this is until further notice, basically. There are certain benchmarks that each county has to meet in order to go off of the watch list. And unfortunately, Riverside County has seen significant increases in cases. And so until we see these benchmarks go down under the levels of what the state considers okay, we are going to be in this situation. So just to kind of throw out a couple of those benchmarks, one of the areas that the state looks at is the percentage of tests that are coming back as positive. So we need to be under 8%. And unfortunately, as a whole, the county is just not there. There's also hospitalization rates that they're looking at. They're looking at hospital capacity data. And so there's many metrics that they're looking at and data points that they're looking at. And every, we have to have that sweet spot that's hit. And unfortunately, the County of Riverside has kind of ebbed and flowed throughout this whole ordeal. We're doing really, really good in the beginning to flatten the curve. I think as time went on, I don't know. I don't know if we just all got into a state of comfort. I don't know what happened, but obviously cases are increasing, and so right now we're where we're at until we can get these numbers back down to where they need to be. And obviously, we know that our community can do it because we were doing it when this first happened.
And you mentioned that the numbers were, and from a resident perspective, we've heard we're going to do this until we flatten the curve. And it looks like the curve was flattened, and now it's saying that we're still flattening. How do you respond? And this is kind of a throw-in. How do you respond to the notion that, although infections are up, deaths are down. So why are we pausing everything with such a low death rate, even though the infections are up? How do you respond to that?
I think the governor actually is looking at more of a hospitalization rates. Those are way up. We're looking at full capacity in our ICU beds. We were at 98%. They're about a day and a half behind on reporting on the website, but as of 2 days ago, it was 98%. We have, I believe it's 13 hospitals in Riverside County. Don't quote me on that. It's around there. And when they talk about 100% ICU beds, that means everybody that needs ICU care. 14% of that, I believe, was 14% is only COVID patients. 190 ventilators are being used, but there's still 400 and some ventilators available. But what has to happen is each hospital has to go and license a new bed. One of the other rumors that was out there is that a bunch of people came from other counties. We only have 6 ICU beds or 6 hospitalizations from Imperial County right now, and we only have 6 hospitalizations from correction facilities. You got to remember, just because someone tested positive doesn't mean they're in the hospital. But because of the hospitalization rate and where we're going with that, I think that's what the governor kind of alluded to the other day, was that he was really worried about that. The county is about to act. They have activated the federal hospital in India at the Indio Fairgrounds. I know they pulled some of the staff there today to another hospital, but that is another option for us in the future if we do need to use that federal hospital. But that's my opinion on what I've heard. Again, we only get so much information at the city level.
And one of the things, and this is really hard because, I think people need to understand that, yes, we're representatives of the city, but we're also human beings too. And we have a lot of the same questions that they have. And that's our job, is to ask those same questions of our leaders that are, at the next level up above us. And so, I've heard, and this is a very true statement, the more you test, the more we test, the more positives we're going to have. Obviously, that is, it couldn't be more true than that. And then to go back to what you were mentioning, Bishop, about, the cases are increasing, but the deaths are not. We ask those same questions. Does this truly constitute the need to shut down the economy as a whole? At the end of the day, we are able, from the city's perspective, to talk about the hardships that our business owners are facing, that our families are facing with lack of paychecks. And that's the ability that we have, is to go and advocate that ultimately, at the end of the day, the state is the one that's making those final determinations and putting out these orders. But I can tell our residents here that we are asking those questions. We don't go into these meetings and just sit silent and just take it, as it's handed. We're asking those tough questions because we're human beings too, and we have a lot of those same questions ourselves.
We're very fortunate to have a very active county supervisor, Manuel Perez. He's been very informational to the mayors in the Coachella Valley. As the 4th District representative, he's pulled in the mayors probably almost weekly. It's sometimes it's about every 10 days. But him and his staff, he brings in county health, public health, and answers his questions for us as mayors and council members and staff members of our cities, and gives us the information to hopefully get back to to our constituents. But we all the mayors have the same questions. Why are you closing these businesses and not those businesses? In the last update we had last week, it was, where's contact tracing coming from? Where are the hotspots? And unfortunately, it's coming from the workforce. It's packing plants, it's big box stores. And the worst part of it that we heard was it's family gatherings. So you, the constituents, are the one controlling it. That's where the main hotspots are. And with the holidays just passing us, 4th of July and Memorial and Labor Day coming up, you got to make some tough decisions with your family on how close you really want to be in this situation. We have some stories of friends that are close to us that have, had families that have gathered, and some were asymptomatic, and unfortunately, in one of the families that we know, their father died from corona. So it is a real thing. I hope I'm kind of babbling on here, so I'll let you go.
No, thank you. I think it's important to understand where the hotspots are. And the media, they do their best to tell us what they want us to know at that particular moment. But there's some things that, that, for example, I had never been told that the hotspots were in big box stores and in the workforce. We were always led to believe that the hotspots were in the gyms and everywhere except for the protests. So that's good to know. You mentioned, Doria mentioned relief for our residents and paychecks and all that. And I want to get to there in a minute, but to kind of backtrack to Mayor Modis with our county supervisor, you mentioned earlier that when the governor gives a directive, we follow it because there's state funding that can come down. And I've read where he's threatened counties and cities for not following suit. We had a period of time where it appeared our county supervisors kind of went opposite of what the governor, I guess, put out there. Is that really what happened, or did they just, I guess, activate something that was in the modification rules to allow them to reopen slowly?
There's a lot of political pressure. I mean, you can see it from the governor's side too. There's a lot of political pressure from different groups. Whoever has, a lot of times in Sacramento, it's whoever has the busiest and hardest working lobbying team to get what you need. And so we saw that in the golf industry when this first came out. The golf industry really lobbied hard to the county of Riverside to get golf back open. And so the county was getting a lot of pressure in certain areas from a lot of elected officials, let alone from certain industries. And so there's an attestation. I'm going to say that wrong. Doria, it's attestation.
Attestation form.
Attestation that each county has to follow to try to get their county back open. And following that, what our region was trying to do is separate us from the rest of the county, because there was a lot of hot spots in the western county, and try to make the Coachella Valley region, but they wouldn't honor that. So we had to work with the whole county. So the county supervisors got together and they started pushing back in some of the areas. Our county supervisor actually has a good relationship with the governor's office. So with that said, he's pushing in areas that I believe he can push in, but being very cautious that the county has to be very careful. We're a small city. We're promised certain funding. If you look at Palm Drive today, a lot of that was funded by state transportation. If we didn't adhere to this, there's $4 million sitting out there, and there's another couple $1 million coming soon that could just be ripped out from under us. So you don't want to upset the people that have the money that puts our programs together a lot of times. So with that said, yes, the county pushed back a little bit, but not enough to upset anybody. And I think the governor's savvy enough to know that there's certain things that has to be vetted and talked about to make people understand a little more.
All right. Next question. And for those that are watching, if you have any questions you want to field, we have time to get to them. We'll put them out there and give them a shot to answer them. I'll say this openly, this is not a debate. So if you have any debate questions, you save that for later, okay? We're really just trying to deal with COVID here. All right, you mentioned, Doria, relief for some of our residents and businesses here in the city that don't have income, don't have revenue, landlords and tenants and all those things. What programs does the city have in place to be able to, I guess, offset some of the losses that people are taking right now?
So unfortunately, direct monetary contributions for residents, the city is just not in a position to offer, direct monetary, assistance in that manner. However, there are things that our city council has done to try to provide relief. And so one of the first things that council did was enact a moratorium on rent for not just residential residents, but also our commercial businesses as well. And so that is in place. It's been extended once, and the state actually, since we've put that into place, has also put something into place as well. So there's that measure that's there. We do have guidelines for how folks would need to go about, claiming hardships due to COVID, so on and so forth. And so anybody can reach out to the city, and we're glad to help them navigate through those waters. Also, Mayor Mattis has reached out to our faith-based communities and our food distribution centers here locally to try to find ways in which we could assist and kind of collaborate with the different organizations to centralize some of the needs. And I'll let Mayor Mattis speak to that. The city's also done some contributions directly to Food Now and assisted with getting some donations there as well. So in the ways that we can offer that type of assistance, we have. And then, of course, we are always advocating at our various levels that we can with the supervisor's office that then make its way up to the state level with unemployment issues, so on and so forth. So if anybody is in need and they are finding that they are not able to access resources, we are more than happy to try to assist in any way we can. They can just reach us here at City Hall.
And the SBA and the county has some grant funding also still. I know there's some money being returned through the SBA that will be available to some business owners. It's a lot of paperwork. I understand it. I know I talked to a business owner a while back, and he's just like, I just can't do all the paperwork. And that's a choice. I'm not going to force you to do it. The county also has some relief. It's not a lot of money. It has to be related to COVID, but some businesses that have to get supplies and stuff, it could be some money. And there is some rent relief money in there too. But if you need help on that, Doria has a lot of information. You can call City Hall at 760-329-6411 or send them a message on social media, City of Desert Hot Springs, and they can get those answers to you.
Okay. I had a question that came in on Facebook, and I don't want to put you on a political hot seat because I understand how these things work. But there's been a question about casinos. We understand that casinos are sovereign land, and they're basically moving at the pulse of, however their leadership is moving them. But I guess a fair question can be asked. If, for example, pastor of a church and we moving everything again to a virtual format, other businesses and nonprofits are doing the same thing. If the county is adhering to these guidelines from the governor, but we have, say, the casinos who are still open and running full speed, and COVID is still spreading, do you feel that we'll be penalized because of the spread that's continuing to go forward? Or do you feel that something will be done to kind of, it's like that analogy where my daughter would say, we didn't get our recess because one kid didn't know how to stop talking, right? So we had to say, so are we going to be able to get our recess, or do you think we're going to be stuck, in detention forever because, of what's going on and because they are sovereign land?
So the tribal members have been part of our conversations with the county. Okay. And there's obviously a very big lobbying group when it comes to those types of businesses. There's a lot of people employed. There's a lot of money being lost. There's tribal members that support tribes within, this obviously these businesses. But to answer the question, it's got to be common sense. Can you do it in a safe way? Do I think the spread is coming from churches and gyms? Probably not, because you just reopened. So that's just an opinion from a person in a community from the information that I've read. My mayor's hat sticks on and says that we've got to do our job to follow the orders, but it's a decision that has to be made by businesses, nonprofits, faith-based. You have to make those decisions based on what you feel you can do safely. The spread is, the age groups are 18 to, let me look at this real quick. So 18 to 39, you have 11,000 cases. 40 to 64, you have 9,000 cases. That's the two age groups that are spreading it. So in symptomatic cases, I had a question from an individual that was on my phone yesterday that I had Doria research, and she's got some answers to today. It's good information to know. If people are getting tested, which takes less than 5 minutes to get tested, it takes longer to fill out the paperwork online and longer for that paper to print out. And when you go to get tested, it does get tested, and you can get your test back in usually less than 72 hours. Be responsible. Go get the test, and if casinos are going to stay open and faith-based are going to move to casinos in places where they can, ask the question. The hardest part is that for people to understand is that there's HIPAA laws and that public health has to follow those. So people don't have to reveal their illness. We don't know who has the illnesses in our community. You can ask the question as a person, but they don't have to give you the answer by law. So, Doria might be able to talk a little bit about asymptomatic, which might be interesting too.
Right. So there's a lot of questions that come up with respect to asymptomatic spread and protocols for asymptomatic spread. And I think I'll touch on this very briefly. I'm very careful to not infuse my own personal opinions into these dialogues because I don't think that that's very helpful. But I will say this. I think one of the biggest challenges that everybody has faced in light of COVID is the inconsistency in the information that is out there. And so when we look at asymptomatic spread in particular, there is a lot of inconsistent information. There was a report that came out from, I believe, the World Health Organization, about a month ago that said they didn't think that people that were asymptomatic were responsible for spreading the disease. And then there was something recently that was put out by the CDC that said, whoa, nope, we think 40% of the increased cases are coming from asymptomatic spread. And then there's a lot of talk in between. So this is what I ascertained today from the county, because one of the biggest questions that we get is, are people that are testing positive but are asymptomatic, are they allowed to just go out and act like this is not affecting them confidently, because they're asymptomatic. So if they're asymptomatic, then they shouldn't have a problem. Wrong. The county is strongly encouraging anybody that tests positive, asymptomatic or not, they should be quarantining for 14 days so that they can go through the span of the virus. Because you're asymptomatic today doesn't mean you will necessarily be asymptomatic 2 days from now. And so they do take that very seriously. That's where the masks come into play. If you're asymptomatic and you just have a cough, maybe not a COVID cough, but just a regular cough, you are spreading droplets. That's where those masks come into play. So many people can be positive and asymptomatic and not even know. And that's where the masks come into play. So county told me today, no, it's not willy-nilly. You're asymptomatic. You just get to go out and live your life. If you are asymptomatic, you should be at home quarantining. And anybody that you've had contact with should also be going out and getting tested. And if they're testing positive, also quarantining for that 14-day period.
And if you're asymptomatic, you got to remember, again, as Doria said, I want to make that very clear. You should have a mask on. You should quarantine for 14 days. You can get tested by going to the county website, rivcoph.org, push it on the coronavirus, and right at the top of that, get tested. You fill out a form, and it's all secured with the HIPAA laws. And then at the end of that, you get to pick a testing site. I believe there's 13 or 14 around the county, and we have one right here in Desert Hot Springs at the Henry Lozano Center. We can test up to 132 people a day. You're testing on average close to 100 people a day. So, get your test. It's simple. Yeah, I know it's a long little thing that goes up your nose, and it's a little uncomfortable for about 5 seconds, but that's it. And it's actually, if you look at the tested results in the county, we have, as of yesterday, there's just under 300,000 people tested in the county, but we have 2.4 million people in our county. That's less than 12%. So we've got to make sure we get tested. I understand that people think there are going to be too many positive cases, but we need to know. They need to get this. We need to get it under control and get the curve flattened.
Right, and I'll even go as far as saying, just really quickly on the asymptomatic cases, without going into a lot of detail, a couple people that I am aware of that have tested positive were asymptomatic, and the only reason they ended up getting tested was because somebody else that they knew had tested positive. And so I think one of the good rule of thumbs would be walk around like you may be carrying this virus, and that's where the masks come into play. And I think if everybody does that, doesn't mean that you can't go to the grocery store. I mean, unless you have a positive confirmed case, then you should be quarantining. But right now I go, and I've been tested about every 3 weeks is how often I'm going and getting tested. But if I'm out and about, I always go out thinking as if I'm positive. So that really helps me to force myself to stay 6 feet apart from people, making sure I'm wearing my mask, so on and so forth. And if people are doing that, that is going to help us significantly in reducing the numbers so that we can try to get back to some sort of normalcy in our lives.
So is it safe to say, because the question came in, why should I test with no symptoms? Is it safe to say that if you have been in contact with someone who has tested positive, whether you're showing symptoms or not, you probably should go get tested?
You should.
Yes, and most businesses have those policies where if you come in contact or someone within the business has come down with COVID, the contact tracing has been done, public health's been noticed, public health will say that everyone within contact should be tested. Doesn't mean everybody goes home, because some businesses you might not have come in direct contact with that person. You know, you're not going to hear public health come out and say, XYZ store down the street was selling widgets the other day and Joe Smith came down with coronavirus. Just want to let everybody know that's against the law. But you are hearing things such as a big box store a couple weekends ago closed for 3 days to do deep cleaning. Putting logic together, someone was obviously that came down with the virus and they had to deep clean the store. The store's not going to release the information, nor are they going to say that someone was positive. They can't by law. So just got to put logic together.
On that note, really quickly, one of the things I'm going to say, we've got some information that came in from the county. It's a public health toolbox, so to speak, and I just want to let everyone know we're going to post this on our Facebook page and on the website. It is geared more towards businesses, but I mean, anybody that's an employee somewhere would be interested in reading this because it addresses a lot of the questions that we're talking about right now. So there's 3 documents that I'm going to get on social media and our website. One is what to expect when employees are quarantined or isolated. What should I do if an employee is suspected or confirmed to have COVID-19? And 5 essential actions for individuals to reduce the spread. So I read through this, and this was super informative for me and educated me, quite frankly, on some of the protocols that the Department of Health is taking. And I think it would be really helpful for other folks. And it also talks about ways that businesses can assist the county in kind of facilitating this contact tracing to notify people that they may have come in contact with a positive COVID case. So we'll get these posted. I just wanted to mention that really quickly.
Okay. We mentioned masks, and I actually saw someone make a pretty sly remark on the mayor's page about, well, that's the pastor that had the little police forum in the height of this pandemic. And I wanted to respond, but I'm learning not to. But at the time, the governor had open houses of worship with the stipulation that you could occupy 25% of the capacity, no more than, I think, 100 people and all that kind of stuff. And I think, Doria, you were there. You saw people were spread out. We had masks on and all that kind of stuff. And being someone who has breathing issues, the mask issue kind of affects me both ways. One, I can't keep a mask on longer than 20 minutes without feeling like I'm going to have an asthma attack. And 2, because I have compromised lungs, I believe that if I'm going to be around you, I need you to wear a mask because in case you have it asymptomatically, I would have you. So I know I'm not the only person in the city that has these issues. So what are we doing as a city to can't really use the word enforce because that kind of insinuates that the police are coming down to put handcuffs on people without masks and they have fireworks to go after. But we need to talk about that. But what are we doing with our businesses and our nonprofits and whomever else, just people in the street? What are we doing to kind of ensure that the word is getting out there that you should have a mask on in public? If not, what's happening?
So a couple things. One, all the mayors in the valley got together and did a PRA or not PRA, Public Request Act. No, we did not. We did a PSA, public service announcement on wearing masks. There's been, so the CDC keeps going back and forth on exactly where the virus can come from, what it is, but they've actually narrowed it down to it's droplets in the air. And the biggest way that you can get it is when you're within 6 feet of somebody and you have droplets out of your mouth coming into contact with droplet into somebody's lungs. So with that said, again, it's wearing the mask. You have less than a 1.5% chance of getting this coronavirus. Not wearing the mask and coming across somebody that has the virus, it jumps up to like 30%. And don't quote me on that number, but it was a demanding number. It was like, wow, if you're in contact. So you have to be very careful. And the reason you're wearing the mask is, as the bishop says, is to protect you and protect others. Now, sitting in one of these meetings we had with the county, we had the county council and public health on the line to be able to answer questions for us. And one of the questions was, how do you enforce this? And especially businesses, because it is enforceable now by the governor that all businesses must have a wear mask mandate in their stores. It wasn't for a while. So a lot of people, especially, you have extremeness on both sides. You have the extreme people, and I've heard from all of them. You have extreme people that say that we're killing people by not having sending cops out to arrest them for not wearing masks. And then we have the other one saying that you're causing me health problems by forcing me to wear a mask, and I have a civil right not to wear a mask. And so the county council, which is the attorneys for the Riverside County, said, look, the businesses can make those decisions, but the order is that they wear a mask. Now, if somebody walks in and goes straight to the manager and or someone in charge in the business and states, hey, I have a health problem, I can't wear a mask, would you be comfortable if I shopped in here? They can make a decision to allow that. Or they can make a decision to tell them, no, we don't feel safe with that. That's the proper way to handle it. But a lot of people handle it the way they feel they need to handle it because they're upset or angry at the situation. You can call the police department, you can call code enforcement, but it's not a top priority for us to race down there and try to force a business to force a mask to be worn. We have to prioritize what calls we take and where we go. And so it's very hard, but the city of Desert Hot Springs did. We felt as a city council, since the governor had and the county had put the mask orders on and taken them off and put them on, we continue to keep a mask order here in our city. And we did that based on the region. We as mayors in the Coachella Valley formed an alliance to make sure that we were basically doing kind of the same thing. So we all came up with mask ordinances so that when you travel around the Coachella Valley, at least, you knew it was required wherever you went. But again, it's policing, enforcing, that is really tough to do. It is a responsible thing for you to try to think logically on what could happen to you and or somebody around you, and we hope that you would adhere to that.
One thing that I'll add to that, we had a lot of issues, I would say really in the beginning of this, where there was nothing consistent about orders for masks. And so businesses were inconsistent. I think when there is just conflicting information and people are left to their own devices, you're going to get that. So what our stance with all of this from the very beginning has been trying to seek compliance through education. And so we had a couple pretty large stores here in the city that were allowing people, even though we had a local mask order, to continue to shop in the location without, addressing it. And so I can think of one store, I'm not going to call them out, but I can think of one store where our code enforcement and police department went down there a number of times to say, hey, look, this is a problem. This is a massive problem. You're an essential business. And so you can be open, but you need to make sure that you guys are enforcing the wearing of masks in these facilities. And so we're at a point now, and I've seen it myself when I go into shop, I think people without masks are almost kind of ostracized, quite frankly, if they're walking in without masks at this point. I've been to some of our local convenience stores, 7-Eleven. I can't tell you how many people I've seen turned away from 7-Eleven because they don't have a mask on. And so I think we're starting to see more and more consistency there. Now, again, you do have folks that like you, Bishop, that you have asthma, you have health issues, and people with health issues are able to opt out of wearing the mask if they go about, well, because of HIPAA, you actually don't even have to say that that's what you're doing. But so long as everybody else is following the mask order, it helps to protect you. And I think that that's the important thing. And so back to the original question, what are enforcement actions? It's education. We're always out there trying to educate people on what the orders are, why they're in place, and trying to seek compliance that way. And I think we've come a really long way from the very beginning as far as getting that compliance with the masks. We're always going to, I think, have some sorts of segments of our population that are just not going to comply. Unfortunately, there's not much we can do about that because we are not going to arrest them. I'm just going to say it. We're not going to arrest somebody that's not wearing a mask. We're not going to do it.
On the other hand, we do have the city council has given enforcement policies to our staff. So if you do have a business that isn't adhering to being closed like they're supposed to or not forcing face masks, you can report those to the city of Hot Springs at 760-329-6411. I encourage you not to call 911. It is not an emergency, but that has happened. With that, if it's a weekend and no one's in answering the phone, you can call the non-emergency line and get the police department. What we do is that, again, we first go out and we give a warning to the business. Second time we have to go to the business, we write them a notice of violation. The third time we report them to the state task force. And or we have given drastic measures, the policy of pulling a business license if we have to. If a business is basically saying, nope, we're just not going to do it, we don't care what you say, you can't stop us, we do have that right to pull their business license, and we will do that. I will say that the city does have an enforcement policy. And again, as you started with this question earlier, there's people out there that just say things that they shouldn't say and don't put the right facts out there and make up facts, especially in social media. And you really shouldn't do that in this type of thing. If you don't like me as a politician, I get that. You can make up all the stuff you want about me. But when it comes to people's health, that's what's important. And you shouldn't say that the city is not enforcing, because that allows people to think that they're not. And this person was on social media recently telling people the city doesn't do anything, they don't enforce. That's not true. We could show you hundreds of calls of service that we've gone to try to educate and to enforce the orders that are in place. So that's just disturbing sometimes when you see that stuff. And when you hear about, you having your forum, most of the city council stayed away from that forum to allow seats and make sure that there was extra places for people to sit and make sure that people could social distance. Everybody was on the same page. People were, doing what they're supposed to do per the guidelines, and then you're bashed for that. And it's just, it makes me sick to my stomach sometimes that people just make up things out there and they really don't have the facts behind them. But that's the world we live in sometimes.
Dangerous time, especially with a lot of misinformation out there. And that's kind of why I wanted to do this, so they could hear directly from you two concerning what's happening. Because like you said, we've seen so much in our city, in our valley, county, and region. Misinformation, a lot of stuff that's going out there. We've seen some renegades, and I know a couple of business owners who have said we're going to do what we want to do, and without hearing from city officials, it almost seems like they are able to do what they want to do, and then it's like, well, what's the point? Then why are the rest of us following rules and all that kind of stuff? I can be transparent with you all. Like Doria said, or I think the mayor said, the spikes couldn't have come from the churches because we just reopened 3 weeks ago. So it wasn't us. We didn't do it, right? But then you start to see it. So it's like, okay, we're going to comply because we're going to do the best we can to be good neighbors, like our faith tells us to do. But then you look up the road and you see people not complying or whatever. That kind of gets a little frustrating. But thank you for clarifying that. I have one more question for you, and then you guys can close out with anything you want to say. Mayor Modis, I've been asked by John Tinker to jab you a little bit and say, will there be fantasy football this year? You can get with him later. Something has to happen this year, right? Mm-hmm. But here's the last thing. I understand HIPAA laws. They can't disclose the 5 families that have tragically lost someone to this virus. And they can't disclose those that are, currently dealing with it. Is there I know at Word of Life we have sort of a fund to help out with families that may have, have a tragic loss or something like that, if it comes our way, right? Because we don't know. But is there anything in the city to where there can be a fund set up or something to help these families that do happen to have? Because from what I'm understanding, when someone gets COVID and it's a major case of COVID, they're taken to a hospital, put on a ventilator. Family can't see them; they have to Zoom call or what have you. And in many cases, those people don't come out of there. So someone's life could be just changed within a matter of 2 or 3 days. Is there anything in place in the cities where we can help those families? Should we know who they are?
So, first of all, I got to answer the fun question first, and then I'll get serious. John, yes, there will be fantasy football this year, but obviously it won't be a gathering. It'll be a auto draft most likely, or some kind of Zoom draft. Who knows? But go Raiders! Sorry, Bishop.
Wow.
I know you're a Giant fan.
That's offensive. Okay, go ahead.
But to be serious about it, I look at it this way: it hit me, it hit home with me. I'm a grandfather for the first time. My son and his wife had my granddaughter last Monday. I could not be at the hospital. He had to stay there the whole time with her, which God bless him. It was 4 days of labor, and the baby finally came, or 3 days of labor. Sorry. But I can't see my granddaughter till next weekend. She needs to quarantine for 14 days, so she's going to be almost 3 weeks old before I visit my granddaughter for the first time. That hurts. I can't even imagine what someone would have to go through if their family member was put into ICU. There was a story on the national news this morning when I was heading out of the house of a family, and she said goodbye to her kids. I got to go to the hospital and get fixed. I'm feeling bad, and she ended up on a ventilator and she ended up passing. The kids didn't even get to. How do you cope with that? I don't know. I just don't know. It really bothers me. With that said, it comes back to HIPAA and people being open about if they have these issues. So I think what we need to do is put out that we're there for you. And this community in Desert Hot Springs is fantastic. As Doria alluded to earlier, when this first hit, I reached out to the faith-based organizations and put all the pastors, as many as I could, together on a Zoom call. First of all, a telephone call, and then it ended up in the Zoom. And then we added the food programs, and we added the senior center, we added Rotary. You see how we could collaborate with the community. Our biggest food program, Food Now in the community, was feeding on average 300 people a week, 300 families a week. They jumped up to 550 families on average per week. That's not including the homeless program that you guys run at Word of Life. That's not including St. Elizabeth's Food Pantry. That's not including the senior center and what they do. So there was collaboration needed to be made, and there was. If we could collaborate like that and help these families and get food to them, if you're out there and you have a need because you've lost to COVID, I guarantee we'll find you the assistance you need in this community. People have this stigma about Desert Hot Springs. They don't understand how big our hearts are out there and how much we do for each other in this small community. So again, I commend this community for having such big hearts.
Great.
The last thing that I just want to say is, and I saw Jackie's question, the county does not notify the city of who's directly impacted. They made that very clear from the very beginning that was, there's HIPAA rules and they are not going to let the city know. So we don't know, directly. The city is not notified of the specific death, who that family is. So the only way that we could help is if the family directly came forward, as the mayor mentioned, and asked for that help. And like he said, if they reach out to us and they indicate that they're in need, we are more than happy to try to get the coalition of our residents together to assist. Our residents have the biggest hearts out there, but we do need them to come forward. We don't know who they are.
All right. Well, those are all the questions that we have. You all heard it here directly from our mayor and our assistant city manager. They are accessible. They are willing to answer questions, especially Doria. She's all over the place. So if there's any information you need to know, please get a hold of her. The city's phone number is 760-329-6411. So if you have any questions, you can get a hold of them. I would say, and I'm going to give the last word to the mayor and Miss Doria. I would say that one thing that we've stressed at Word of Life is we're focused on the news for our region, for our city. Our city, I have friends on the East Coast that would see something like, oh my goodness, LA is, going crazy with COVID. And I'm like, yeah, we're 2 hours away. Okay. So we're not going to move based off of what's happening 5 cities over. We're going to move based off of what's happening here. And so for those of us that are watching that are in the city, we have an active city manager, assistant city manager, mayor, and council. You're able to actually go to the City of DHS page and catch updates. It seems like every other day almost as these things start to come in. So you don't have to speculate. You don't have to rely on regional news. We have local city news right here in our faces. So I pray that we all take advantage of that. And Doria, if you want to give them your contact info, and then Mr. Mayor, you have the last word. You are the visionary for this city. So we're following you as we get through these crazy waters. And we take our hats off to you. None of us have ever, I told the church that you can't find a pastor who's ever been through a pandemic before. The last one was over 100 years ago. And if there is a person pastoring after 100 years, I want to meet him because that's absolutely crazy that they lasted that long, right?
Yeah.
We're all, this is uncharted territory for all of us. So we salute you both. And Mr. Mayor, we salute you. And Miss Victoria, our mayor's wife, is on. We say hello to you. Thank you for joining us. Even though she's not showing her face, she's here. Okay, so Doria, then Mr. Mayor.
So really quickly, I do want to just give a shout out to Luke Rainey. He's on the call as well. He's also not showing his face to us. He's our deputy city manager, and he's here as well. So I just want to say a big thank you to him too, because he's very much in on all of this and what is going on. As far as reaching out to me, so I'm going to give you guys my cell number. You guys can call, but I'm going to tell you, if I don't recognize the number and I'm in a meeting, I may not answer the call straight away. So you'll either have to leave a message or text me and say, hey, Doria, it's so-and-so. That's super effective. So my cell number is 760-333-0518. You can also reach me by email. My email address is dwilms, it's WILMS, @cityofdhs.org, or you can always do it the old-fashioned way, call City Hall. I am working more remotely now than I was before. I have an autoimmune disorder, so I'm also trying to not put myself at risk unnecessarily. So if you call the main City Hall number and you speak with Emily, she can track me down if I'm working from home. So there's 3 ways you can get in touch with me. And if I don't personally know the answer to your question, I will find the answer for you. So thank you everyone for having us.
And I again thank the Word of Life for hosting this tonight, and Bishop Shepherd. I've known you for many years now, and it's just you're a fantastic piece to our community, and keeping the information out there is so important. Having the police forum recently, and then now having this, it's just more information. As I said at the beginning, this is power, and the more facts that you have is great, because you can't believe everything you see on social media. You can't believe everything that you see on the internet. Can't believe everything you see on the news. It's just it's how people want to twist things. And so I try to pride ourselves on getting the facts out there and letting you make those decisions. That's what's important. We have a fantastic staff. As you see, Luke Rainey, our deputy city manager, our assistant city manager is here helping me today. Our city manager, Chuck Maynard, have been just on top of this from day one. It's hard, and I was at this position before I was in the city council, where you didn't pay a lot of attention to your city government until something goes wrong. And so a lot of times when it comes to COVID, that's the same thing. It's not affecting you, so why should I listen to what's going on? Well, we don't have a vaccine. And I say we, meaning the nation. Will we have one soon? I don't know. People put rumors out there that, once summer hits, the virus will burn off. We're hitting some of the highest cases right now that we've ever had in our hospitals. That ICU beds are at full capacity. So we don't know what this virus is going to do over time. And if we continue to keep businesses shut down, we're only going to lose business. There's already one gym here in town that filed bankruptcy, and they're blaming it on this right now, but he just couldn't survive. So with that said, I just don't want to see a myriad of businesses fall behind that. if we can get things under control in our county, we can get these businesses back open and they'll be successful. We have essential businesses that's never going to stop here in Desert Hot Springs. You still can go and get your groceries and do your stuff, but be responsible. Wear that mask. It's just, if you really look at it, I timed it about 3 weeks ago. I wore my mask, not at work, just doing my daily things. I wore my mask less than an hour. Now, I work for a company that mandates a mask to be worn when I'm around my team members, so I had to wear it a lot more that day. But for the most part, going out, doing my errands, it was less than an hour throughout the day. Be responsible, be logical, be respectful. Those are the things we can ask from you. I'm one vote on the city council. I cannot go out and enforce every enforcement request. I've had people say or text me, someone told me that they saw someone who said that somebody wasn't wearing their mask at this store. Can you send someone to that store? No, I can't. I need you to call immediately the number at City Hall, code compliance, and report that so code compliance can make a decision if they need to go out or not. With that said, it's in our hands, Desert Hot Springs, to be able to make this go away. We have to do our part, and I hope that you can. From your kids not going to school right now, which is probably the hardest thing, all the way up to our seniors quarantining themselves because they're at risk. We just need to be good neighbors and make sure that we check on each other and make sure that we keep our mental state in control, because this is what people start to think. They start to overthink everything. So again, reach out to my office, reach out to Doria, whatever we can do from a city, we're going to be there to assist you. But it has to be a logical request is what it needs to be, and sensible, and we'll do our part.
I want to say thank you. Oh, go ahead, Doria. Go ahead.
Just really quickly, I meant to say this earlier. We get a lot of questions about testing locations. We have one here in town. The mayor mentioned it earlier. It does require an appointment, but I will tell you, every time I've needed to get an appointment scheduled, I log in online, and I'm able to do it very, very quickly. As a matter of fact, I think our testing center here is one of the most accessible. So I just want to remind people, it's located at the Henry Lozano Community Center. That's at Guy Tedesco Park. It does require an appointment. So you can either call 1-888-634-1123 and make an appointment, or you may also log in or access it online. It's lhi.care/home. And if you go there, you will need to set up an account. But as soon as you do that, you would be able to make an appointment. So again, just want to remind everybody that it's there. If you need it, you do not need a doctor's referral. You are able to just ask for the appointment and then make that and go in. So
it's not an antibody test. It's not an antibody test.
No.
It's just a general test to see if you're positive.
Correct.
And I'm sorry, last question. And can you please explain to everyone the difference between an antibody test and a regular COVID test?
Yeah, antibody test would be that you had COVID at one point in your body. You can get those tests. I believe it's a $10 fee to sign up. It's a free test, but it does cost you $10 to sign up for that. And you can also find that, I believe, on the county's website. They can get you those locations. But the antibodies means you did have it at one point, hopefully someday, I'm not a doctor and I don't want to make any health promises, but hopefully from those individuals that they have antibodies, they can find a cure for the virus.
And then the other test is literally a point in time test. And I think that that's also important for folks to keep in mind. So you make your appointment, you go in, they take your nasal swab, and the results come back. But that just means that those are the results at the exact moment that they took that nasal swab. So you could walk out and come in contact with somebody 2 hours later and not know that you just contracted the virus. You get your test results in a couple days. So just because you've been tested and it comes back negative, keep in mind that is a point in time test. And so you need to be, again, going back to what I mentioned earlier, if everyone kind of just uses the rule of thumb, I may already be infected, that will help us go a long way in kind of driving down these numbers, because then we are going to go out there and make sure that we're social distancing and protecting others, because that test that you're taking is just a point in time test. So it doesn't hurt to go and get tested, every couple of weeks at all.
That's good to know. Well, thank you. You all, thank you for your time. I promised you an hour at 6:57. I'm a man of my word. So we'll get up. I would just ask that you all just remain vigilant and please, please, please walk around as if you have it. And that way we can, stop this spread. Finally, I ask that you both just, and everyone listening, check on my wife and daughter. They're stuck home with me for the next few weeks. I don't know how they're going to do it, but hey, they got me now. So you all have a good night, everyone. Thank you so much for everything.
Thank you for having us.
All right. Bye-bye. All right. End meeting for